Ooh, you say that elbow's been bothering you, been doing a little bit too much construction and using the hammer a lot? Ouch. I've had the same problem before. Some people call it golfer's elbow or tennis elbow. To be honest, I can never remember which one is which because I don't do either. But the elbow has two big knobs on them, on the outside and on the inside, called the epicondyles. And there's a bunch of muscles and tendons that attach there. And if we do a lot of repetitive motions with our hand and our elbow, we can develop pain at the epicondyles. And it can form here, here, or both. And it's something I've dealt with a lot. I don't find it fun, and I see it a lot in my patients. So I'd like to show you a couple things that can help with this. What you'll hear it called most of the time is medial or lateral, medial meaning inside, lateral meaning outside, epicondylitis. And what's happened is we've hurt it, we've inflamed it, and then our body puts down some scar tissue in an attempt to repair, and that scar tissue doesn't move like normal healthy muscles and tendons, and that's what causes pain. So if it's been going on for a couple days to a couple weeks, it's epicondylitis, but if it's been going on for weeks to months, we call it epicondylopathy. Not a huge difference, but for name nerds like me, it's worth knowing. So how do we get the pain to go away? We want to first change what we're doing so that we're not hurting it all the time. And then we want to reorganize the fibers in the muscles to get rid of the scar tissue, to make the scar tissue a little bit more stretchy like regular healthy muscles and tendons. How do we do that? We do that by a series of exercises called eccentrics or loaded lowerings. Normally when we're working the muscles, we tend to focus on the up portion or the concentric. For issues with chronic pain, we typically want to focus on the negative in a controlled lowering way. If we're talking about medial or inside elbow pain, medial epicondylopathy, the muscles that attach here are the muscles that close the fist, flex the wrist, and rotate the thumb in and down. On the outside of the elbow, or the lateral epicondyle, if we're having pain, lateral epicondylopathy, those are the muscles that extend the fingers, extend the wrist, and rotate the thumb up and out. So what we're going to do is learn a couple of different exercises that reverse those things so that we can, over time, get the pain to go away. It usually takes working on these guys about 10 to 20 minutes a day, 3 to 4 days a week, for about a month or two to notice significant results. So I'm going to ask a little bit of patience, but if you're able to stick with it, you will absolutely notice that it gets better and you feel stronger and you won't have problems in the future. For that wrist and elbow rotation, I like to use something that's a little bit off center. A regular dumbbell has weights on both sides, so I like to use something a little bit long so that there's more lever. A hammer works quite nicely for this, or sometimes you can use a dumbbell with a one-sided weight. So the first exercise, I like to support my elbow so that I can focus on what's hurting. So if I'm going to work on the inside elbow or medial epicondyle, I'll start with the hammer pointing straight up in the air, and I want to do a slow lowering out to the side. So over a count of like 3 to 5, 1, 2, 3, 4, 5, I let it go down under control until it just doesn't go any further. And then I'm going to reset it with my other hand. That way we're not taxing the muscles by shortening them unassisted. So 5, 4, 3, 2, 1, and back to neutral. Try to do 10 to 15 of these. Now, for the outside of the elbow, or the lateral epicondyle, because that's the muscle that keeps our thumb out, we're going to reverse that and let the hammer fall to the inside. So watch this. 5, 4, 3, 2, 1. Let it go all the way down, still in control. We use our other hand to reset it. 5, 4, 3, 2, 1. Again, try to do 10 to 15 of those in 3 sets. For the wrist flexion, we can use something like a bike tire or an old rubber band. So what I'm going to do is load it up with 2 hands until my wrist is all the way flexed, and then I'm going to slowly let it open up. 5, 4, 3, 2, 1. Reset. 5, 4, 3, 2, 1. Reset. And we can also do the same thing with that rubber band. You might load it up with fingers straight. 5, 4, 3, 2, 1. Reset. 5, 4, 3, 2, 1. I could also use something like a water bottle, just anything that you can hold in your hand and has some weight to it that you can control. Load it up. 5, 4, 3, 2, 1. Reset. 5, 4, 3, 2, 1. Reset. And if we're talking about pain on the outside or the lateral epicondyle, we're going to do reverse wrist curls. So we cock our wrist back like we're revving the motorcycle, and we let it lower. 5, 4, 3, 2, 1. Reset. 5, 4, 3, 2, 1. Reset. And another way to do the rotations through the wrist and elbow is using a towel or a belt. You can wrap it around your head, pull it apart, and rotate those wrists in and out, maintaining constant tension and control. So you can do it so that the tension is coming around the outside top of your hand, like between your thumb and forefinger, or so that the tension is coming out through your pinkies. Same thing, pulling it apart and rotating it in and out under constant tension and control, both elbows bent, or both with elbows straight and with elbows bent. That changes it a little bit. Both of them will be valuable in healing that forearm pain. I've got a separate video for towels with elbows. And we also don't want to neglect the hands and fingers. And I'd also recommend you check out my video on finger arthritis and using a rice bucket to make those fingers and hands feel healthy. Another couple items I found that you'd be able to assemble pretty quickly from stuff hopefully around the home or easy to find at your local sporting goods store or general store are a weight with a string wrapped around a dowel or a stick. The reason I find this helpful is because with eccentrics or with chronic elbow pain, we want to avoid shortening the muscles. So if we wrap the string up all the way before we pick up the weight, then for negative wrist extensions or lowering, if the string is on the far side of the stick from you, you'll cock your wrist back and slowly let it open. And then you just let go, hold it with the other hand, cock your wrist back, and slowly let it drop. This way you get a bunch of negative reps in without having to worry about the up portion. If you wanted to do inside elbow, you'd have the weight and the string towards you. And so then you'd cock your wrist down, grab it, and let the string rotate down this way. So find a string long enough where you can get 10 to 20 wrist rotations. When you're done, you come over and you just roll it up like this, saving the stress on your elbows. Another one that Fred came up with is a little bit like nunchucks. If you can wrap a rubber band, connect a rubber band to the ends of two sticks or dowels, then you can do a similar thing for the hammer curls. I'll pick the weight up, and then now it's tensioned, and I'll let it slowly open up to the outside. So if I'm having medial elbow pain, these will be eccentric external rotations or supinations. The rubber band is nice because it's not a lot of weight, so it's less work on my shoulder and grip. But the rubber band helps the direction for the rotation, which can be hard to simulate or keep consistent. So if you're having lateral elbow pain, you'd pick it up, get it vertical, and slowly lower it to the inside or pronate. Reset it to vertical. Whoops, that one was fast. Incorporating these can be a nice alternative to the other exercises that I've shown you. Fred also wants everybody to remember that elbow pain is usually a sign of a shoulder not being in the right position when we're doing things that require a lot of repetitive movement or high strength or tension on the muscle. And what he means by that is many times if we have shoulders that are high and forward, then if we are, for example, let's pretend I'm doing a pull-up. If my shoulders are high and forward, that puts a lot of stress on the inside of the elbow when somebody's doing pull-ups. Whereas if they bring their shoulders down and back and then their forearms are vertical, then there's only a minimum amount of bad stress on that elbow. You can see how this looks different than this. And the same thing if we're pushing something away from ourselves. If I've got shoulders high and forward and my elbow's sticking out, then there's not a lot of stability here, and that can be hard on the elbow. So if I'm ever pushing something away, shoulders down, shoulders back, bring the wrists close to about rib cage level here, and then as you push, the elbow is much more stable and isn't in a compromised position. So if you're having elbow pain, think about how you push and pull and reach with your shoulder.